Opioids work by lowering the number of pain signals your body sends to your brain. They also change how your brain responds to the pain. Doctors most often prescribe opioids to relieve pain from toothaches and dental procedures, injuries, surgeries, and chronic conditions such as cancer. Addiction is a disease that affects your brain and your behavior. At first, you have control over your choice to start using the drugs. If you misuse the drug, its pleasurable effect eventually makes you want to keep using it. Over time, your brain actually changes in certain ways so that you can develop a powerful urge to use the drug. Simply look around and do it. Anything you want to do it. Want to change the world. There's nothing to it. Anna Lemke, the author of Drug Dealer MD, wrote an interesting book about opioid addiction, who believes that the doctors are the cause of the addiction from prescription opioids. Her attempt is to understand how well-trained doctors ended up prescribing pills that are killing patients. Lemke explains that doctors are pressured into treating the intolerable pain patients endure. The pressure to treat pain has become so overwhelming that doctors who leave pain untreated are not just demonstrating poor clinical skills, they are viewed as morally compromised. The pressure that these doctors must endure is creating more addiction than ever before. It shows that even if they know they have an addiction, doctors will still act to get their patients on the drugs. Next, I looked into a case study by Thomas McLean and Barbara Turner. The study was to look at the overdose deaths in West Virginia. 50% of the addicted patients were prescribed these drugs. Half of these deaths, doctors prescribed this pain-relieving drug. When analyzing the data that was taken, physicians should consider an opioid agreement with patients, which basically means no sharing the drugs and allowing urine screens, no early replacement for lost prescriptions, and safe storage with the drugs. Catherine Wang and 5 others conducted a national representative postal mail survey of 1,000 practicing interns, family physicians, and general practitioners in the United States between February and May of 2014. The adjusted response rate was 58%, and all physicians believed that prescription drug abuse was a problem in their communities. However, only 2/3 correctly reported that the common route of abuse was swallowing pills whole, and nearly 1/2 reported that abuse deterrent formulations were less addictive than their counterparts. Also, only 1/3 of physicians believed that interventions to reduce prescription opioid use had moderate or large effect on the preventing patients clinically appropriate access to pain treatment. A story that stood out to me was a girl named Rebecca. When Rebecca was 14, she blew out her ankle during cheerleading practice and was prescribed opioid painkiller pills. Instead of getting better, she quickly found herself addicted to powerful opioids and eventually turned into heroin. She's not alone. 80% of heroin users started with a prescription painkiller. She had been an accomplished dancer and athlete, and that was lost when her addiction took over her life and self-image. Now Rebecca is regaining control over both, courageously making her detox public in order to help people while she works towards a new start. Doctors should have watched her more carefully and had set appointments to avoid her becoming addicted at such a young age. Doctors have to take responsibility of providing this strong drug to her. She could have died from this addiction like many people do. As young adults, we are so active and involved with so many sports and activities. This girl was so active, and because a doctor prescribed her a painkiller, she later became addicted. This addiction can happen to anyone, even at age 14. Many people argue that it is the patient's fault for overusing the prescription opioids. Doctors assume that they are capable to take these drugs, yet some users may not realize they have a problem until later on. As adults, we need to be respectful of what the doctor says and how much we should use the drugs. According to the National Institute on Drug Abuse, roughly 21 to 29% of patients prescribed opioids for chronic pain misuse. Doctors should not be blamed because only a small amount of percentage is misusing the opioids, and doctors are just trying to help their patients with any pain. 50% were never prescribed the drug when they became addicted. This explains how doctors cannot be at complete fault because this crisis is still happening behind doctors' backs. Even though these stats explain it is not the doctor's fault these drugs are still getting released to patients around the country, doctors do need to do a better job when giving away the drug to make sure that they are not taking more than they should. Doctors should have follow-up checkups to make sure the drug is being used correctly. Doctors are not well trained to communicate with patients about pain. Patients often overestimate the amount of post-surgical pain they will experience. According to Science Writer, the data suggests providers are doing a poor job of counseling patients on realistic pain expectations. Patients who are anxious and frightened will experience severe pain, may be more likely to demand opioids, even if other options might be as good or even better. Doctors need to have better training on dealing with patients with pain and provide other ways to reduce pain instead of these strong drugs because they are highly addictive.
And you'll see into your imagination. You'll begin with a spin, traveling in a world of my creation. What we'll see will defy explanation. If you want to view paradise, simply look around and view it. Anything you want to do it. Want to change the world? There's nothing to